when I started working on geropsych, I think one of my New Year's resolutions, and I think I blogged about this, was to set up a living will and durable power of attorney and to get it all in writing before something happens. And so many people don't think of that. And that's largely what complicates my job. I probably have 10 out of 16 patients right now who I'm trying to find out how legally to place them in a nursing home or to put them in a safe environment when there's no person legally able to make decisions for them.
Maybe explain that a little bit to people who may not be familiar with what that is as far as advanced directives and things, and maybe presume that, you know, the people who are listening to this show don't know anything about it. How do you explain that? How do you bring that forward to families when you talk to them about that?
Well, usually at the point that the patient is, that case is in my lap, I'm usually talking to the family about, at the point at which they've developed dementia and can no longer sign legal documents, knowingly cannot, choose someone to make decisions for them when they're incapacitated or not able to make safe decisions for themselves, I'm usually helping them look into guardianship. And the thing I would say right off the bat is if you're in a situation where it's already too late to have mom or dad sign over durable power of attorney, which is something that says, this is the person I want to make decisions for me if something happens, if I'm in a coma, if I'm incapacitated, if I'm not able to make decisions for myself. This is who I want to be the person to make those decisions. And if you don't have that in place and something happens or it gets to a point where now mom's not able to sign documents and we don't let psychiatric patients sign legal documents when they're on a psychiatric unit too. So I'm usually either directing them to the right paperwork for when mom's discharged if she is able to sign paperwork, or, you need to go to an attorney and start the process of guardianship, which is a lot more difficult. You got to get an expert eval from a doctor stating that the person is incompetent and needs to have someone else making legal decisions for them. And then you have to go through a pretty lengthy court process, at least when the person's on a psychiatric unit, because they're considered to be in a safe environment. And so you can't do an emergency guardianship. I haven't done a lot of emergency guardianship for that reason, but there are faster processes. But the standard guardianship process, it can be 6 to 8 weeks, and then if it's contested, it can take much longer. I've seen them where the guardianship process took 14 months before someone was finally made decision maker, and in that time, things are really in limbo, and it's very difficult to get the right treatment for someone who's not competent but doesn't have anyone competent in a position of power to make decisions for them.
It gets very complicated, and I've been on the other side of that as well from a treatment standpoint, when there is no prior documentation, and the patient cannot make their own medical decisions, and it gets very, very difficult from my standpoint, and also from the family standpoint. I was involved with some legal cases as far as getting guardianship and putting things in the chart and that type of thing, and it's a tedious process. Meanwhile, the patient is in limbo, as far as medications and trying to get them where they need to go, not only from a treatment standpoint, but it also can have a lot of financial implications as well, as far as who is making financial decisions for this person, in addition to medical decisions, which may be two different people, and that very much complicates things too. So I'm very glad you brought that up, and I think that is also something that's unique to the geriatric population, not only psychiatric population, but geriatrics in general, as far as getting that advanced directive paperwork, and also something called do not resuscitate, from my point of view, from a treatment point of view, get that paperwork done as well, because it can get very tricky when none of that stuff is done, and I know you've experienced that.
Mm-hmm. Yeah, and also on adult psych, for people who do have chronic mental illness or have mental illness issues and could realistically expect to at some point end up on a psychiatric unit, they make behavioral health advanced directives too, which are fairly easy to find. If you look, I think on the Ohio Department of Mental Health, they have the paperwork. There's some links to it. But there are also behavioral health advanced directives, which we rarely see people actually having them in place. But if you're someone who has had periods of psychosis or periods of, severe mental illness where you've had to be hospitalized and you don't want to have certain medications given to you, or you don't want certain treatment, you can spell all of that out too. So it's important to know that, if you have a history of mental illness, or if you have some expectation of possibly ending up in psychiatric treatment, you can also kind of specify specifically what you want in terms of behavioral health or psychiatry, that kind of thing.
Mm-hmm. Mm-hmm.